I know that the presidency does require a great amount of commitment. It's a huge amount of work, but it's actually a labor of love. And Sam presided over many board meetings, conference calls, many initiatives, a lot of things that are unplanned, all of which really took into his personal time, and it is also his medical practice as well. We are grateful to him for all of this, but we are also very, very grateful to his family for basically sharing Sam with us during this past year. I know that Sam's wife Sharon is unable to be here again. Parents need to be there. But we are very honored to be joined by his mother Eleanor, Mrs. Fleischman, and by his oldest daughter Hannah. So it is my honor to present the.
Sweet.
So on behalf of the board of directors, I would like to present you with 3 gifts. The first one is a plaque. Sam Fleischman, this recognition acknowledges his steadfast commitment and vast contributions to the AASM and sleep medicine while president, as well as his many years of ongoing service and tireless dedication to the organization and the field. And I'm sure because you're probably going to miss the gavel. So we will give you a crystal gavel.
I can break this one.
You can break this one, yeah. The other one you can break somebody's head with. And finally, I am also pleased to present you with a gift card that to sharpen your golf skill.
It's got Pinehurst on it.
Yeah. As somebody who knows nothing about golf. So please join me in thanking Sam Fleischman for his excellent leadership. So it is my honor to be with you this afternoon and to share my thoughts about the accomplishments of the AASM in the past year and where I see us going in the future, both challenges and opportunities. Now, Sam provided you an outstanding summary, so I won't add to it to all the accomplishments during these turbulent times, and these were really turbulent times. I also like to thank him for really guiding me and helping me because there is a whole lot of things that people don't tell you, and Sam took the time to help me and guide me, and I could not ask for a better teacher and friend during this past year. Now, 30 years ago, on a cold, cloudy morning, a young physician straight out of med school boarded a flight to start his residency training in Chicago. As the plane soared through the clouds, he realized that the unfamiliar is now in the past. Everything familiar is behind him. But he soon learned that losing sight of the shore meant that he can discover new bright horizons. He also learned in the new world that it doesn't matter where you started, but where you're going and how high you want to soar, and how you can make a difference. Now, we would all think of this as a narrative of America, and it is, but it is also the narrative of sleep medicine. This field originally was populated by immigrants from many specialties. People who were idealistic, determined, intrepid, who were intrigued by the mysteries of sleep. That was a science. It was a part-time practice. It wasn't a career. It wasn't a life. It was an add-on. Now, sleep medicine, thanks to the effort of all the board and everybody who's been involved, is now a distinct interdisciplinary specialty. Requires the talents of teams of providers, physicians, nurses, therapists, technologists, all of them working with one goal, serving the continuum care needs of patients with sleep and circadian rhythm disorders. Now, we all know that the current environment is challenging. That would be an understatement. Healthcare is facing the uncertainty of troubled waters. I've been very fortunate to work with many leaders of this academy while planning for the future. Now, our members can be assured that the academy is working diligently to assure that the field reaches safely to the other shore. These troubled waters, I see the role of the academy through the immortal words of none other than Simon and Garfunkel, like a bridge over troubled water. Now, the ASM began this discussion years ago, and probably around 2008 during the presidency of Susie Esper. 2 Future of Medicine workshops and multiple initiatives addressing the role of out-of-center sleep testing, integrated evaluation model, integrated care, and all of these are building every year. Now, the Affordable Care Act added new sets of challenges, but it also identified new opportunities. We are no longer a specialty about a single disease, test, device, or medication. We provide care that transcends organ-based specialties, caring for 1/3 of human life, 1/3 that affects the other 2/3, 1/3 that affects every aspect of human life. So the challenge before us is to develop care models that meet 3 aims: optimal patient experience, best quality, and patient satisfaction. Okay? The health of the population while decreasing the cost of care. It is a tall order, but we can all meet it together. Clearly, my role as a president is to continue the march that was started by the exceptional leaders who preceded me and continue it and moving it forward. Another important aspect of my role is to ask, where is this bridge taking us? Okay? It is taking us somewhere. Most certainly, it's taking us toward an integrated care model, toward outcome-based care and chronic disease management. Even as healthcare reform is shifting the sand and it's taking different forms, we all need to rest assured and be confident that the ground underneath us is solid. A growing emphasis on high-quality care, cost-effective care, will favor trained sleep physicians, will favor board-certified sleep physicians, and will favor accredited sleep centers. So we plan to emphasize the value of board certification and accreditation through our public relation initiatives, our outreach to private payers, and our support of key legislators through the AASM Political Action Committee. I'm particularly excited about the forthcoming work of our Expert Quality Metrics Task Force that was led and launched by Tim Morgenthaler. This committee is bringing some of the most brilliant minds in the field to be able to identify quality metrics and how we assess quality in this business. We will also continue to explore the role of telemedicine in the future. Now, educating future sleep physicians is critical to our field. We will develop new models of education, perhaps online resources to medical students and trainees. Some of these could be as electives we offer to school. And this will be very important to enhancing the interest of young physicians. Another aspect to solidifying the future is to actually train the future leaders. So one of my goals is to establish a leadership academy to equip the colleagues who will be leading the field with the skills that are required for the future. All of these all of these will be delineated and outlined in the new strategic plan that Sam mentioned earlier, which is nearing completion after a long period of hard work by the board of directors. As I start my term as president, I want to express my gratitude, immense gratitude to all of those who supported me in this journey. I'm grateful to Wayne State University, the Detroit Medical Center, and John D. Dingle VA Medical Center. Actually, I do owe a good portion of my career to the VA administration and their support of research. Special thanks to my colleagues in the Division of Pulmonary Critical Care and Sleep Medicine, and especially also the sleep group within this, James Rowley, Sushmita Chowdhury, and Dr. Darvishi, who's not here today. I'm grateful to Sam and all the members of the board for their support. And one little secret here, everything we do thanks to the staff. We have some of the best staff that anyone could ever dream of. I owe them a debt of gratitude for professionalism, hard work, and commitment, led by the able leadership of Jerry Barrett, whose actually steady hand is very, very helpful, critical as we move through these choppy waters. On a personal side, I'm grateful to my parents for their unconditional love, and it really, in my case, had to be unconditional. My daughters, Elisa and Amira, who give my life meaning, and most importantly, I'm grateful to my wife, Mary Lynn, for her unwavering support. She may have been crazy, and some people say she was crazy when she agreed to marry me, but since then, she has been a source of strength in my life. I'm positive I wouldn't be standing here in front of you without her support. Yes, there is troubled water. We are facing troubled waters, but together we can face it. Together we can actually all move it, and with the Academy as our bridge. I believe in our membership, and I certainly believe that the Academy and all the work will be the shining city upon a hill. And I believe that our best days are yet to come. Thank you. So, before we adjourn this meeting, Sam and I would like to give